Hi, this is Dr. Dan Purser, danpursermd.com. We have we're just debating our 151st Facebook Live podcast tonight, right? Something like that.
You can say that, sure.
I'm the one who sat here and done all these, so this is 151.
I have
we'll
been
call
here
it that.
with you every single time.
I'm going to put it in here, and you got to label this as 151.
Sounds good.
Okay, we'll just start there. Okay, tonight it's on the top 10 progesterone benefits. I know I've done variations on this theme. The reason I've done that is because I not only design progesterone products for companies, but also my progesterone book. It was my second book I wrote. We decided to go. Well, it was actually my fourth book I wrote. We decided to go with a one subject book, a booklet, because those seem to do better. And people search for certain things on Amazon, so on Kindle. So we used the search option on Kindle to figure out that this was the book a lot of people wanted. It was not out there, and a lot of women need this information. So I wrote this little book, and it's still on sale on Kindle. Get yours tonight, please. It's cheap. And it's been number one 3 times overall on Kindle, so which is crazy. It's been a bestseller for several years now. It pays some bills, I think. I'm not sure what bills, but it pays something. So this is going to go to someone lucky out there. Asked a really good question. I'll autograph it to them, and I don't know how we're going to pick that question. We'll figure it out. Also, design products tonight. We have some progest-avail from Designs for Health. I'm going to give this away to some lucky human woman out there.
And you're going to love it.
I'm going to love it, or they're going to love it?
Whoever wins it.
Oh, they're going to love it. This is Bailey, by the way. So let me introduce Bailey. She's my stepdaughter. She's actually an ICU nurse in real life. Mm-hmm. And she graduated top in her class from nursing school. Frightening. She's come a long ways.
Frightening. I think it's thanks to your help.
Oh, okay. Well, then it's really frightening. And she's going to be here because you take progesterone, right?
Yeah.
You take a lot of it?
Depends.
Okay. we'll get to that in a little while. Across from me is Jackson. He's going to be the other moderator, kind of, taking Brecken's place tonight. Is that right, Jackson?
Correct, yeah.
Will you be playing the theme song, too?
I can, or we can have Will play a little ditty.
So Cousin Will is running the podcast tonight, which is his first time. He's nervous. I see him over there trembling like a little squirrel. So he's shaking his boots, trembling like a little squirrel. And so we're just going to move ahead with this whole crazy podcasting tonight. 151, right?
Yep.
We're going to go with that. Okay, so we're going to talk about progesterone.
Let's do it.
So let's get on this because you guys like me to get right into it and not goof around and not talk about anything else. So we're gonna do this. So I'm just gonna go through the top 10 I have listed just randomly. I didn't do them in any particular order, just as I happen to think of them. I probably should flip the order actually in order of importance, but we'll just keep it this way. Number 1, natural progesterone really, really helps sleep. Progestin, actually, the synthetic stuff, does not help sleep. Do you agree, Bailey?
I love taking my progesterone right before I go to bed because it really does just help you have a great night's sleep. Helps you relax.
You take an RDT, right?
Yeah.
Do you take 1 or 2?
Like I said, depends.
Usually you take 1?
Yeah.
Okay.
Just a little
200 milligram RDT that was compounded.
Yeah.
Okay, good. Number 2, stops 95% of hot flashes. Is that true?
I don't have hot
You've
flashes
never had
yet.
hot flashes.
But yes, from experience working here, that's what I hear a lot of.
So you're supposed to ask me a question about that, Bailey.
How does it work to help calm down hot flashes?
That wasn't the question. You're supposed to ask, what about the other 5%? What causes those?
What causes those?
I mean, that's a question most people would ask. So that's how I'm asking it. So what causes the other 5% of hot flashes? Some of them are from lack of testosterone. Some of them are from lack of DHEA or pregnenolone. Some of them are from lack of estradiol, and some you just don't know. I probably have had about 3 that I just could never figure out why they were having hot flashes. So, and I treat about 2,200 women with progesterone right now. More if you count the products we've made for Young Living, Designs Health, which is a physician company, and other companies. So, so number 3, shuts down PMS. What do you think about that one?
That's personally my favorite effect that it can have on me. I notice that I can get a little grouchy sometimes.
Grouchy all the time.
And I do know it just helps mellow out my mood, helps me not be so on edge, is what I really notice.
Good. So it milds you out.
Yeah.
So you're not throwing things and beating up you don't have a cat or a dog.
You know, Mom always says with my head spinning around with green vomit coming out of my mouth.
Yeah, that's true.
I don't have that.
Yeah, spewing green vomit everywhere. Do you know what movie that's from?
Yeah.
What?
Carrie.
No.
The Exorcist, right?
Jackson is correct.
What?
Jackson, you might win the progest-avail tonight.
Hey, I've got a lot of use for that.
You're dating now, so finally. So
He's been.
I know I'm teasing. So you can give it to some of your girlfriends.
Mm-hmm.
Okay. Kidding. I cracked myself up. Oh, I'm
At
such
least
a dad.
you laugh.
I'm a dad. Okay.
It's okay, I'll just cry over here. It's fine.
I'm a dad. Okay. Number 5. Can dramatically treat endometriosis.
Yeah.
Have you ever heard anyone say that?
Yeah, I know that endo is something a lot of girls, especially my age, have issues with, and they've seen great success in all sort of side effects and everyday issues.
If they take birth control pills, I know that's done quite a bit in your generation. Mm-hmm. It's kind of become the
standard.
Yeah, the standard, the sine qua non. So I'm really going against the standard by suggesting the natural options. Did you know that if you're under 18 and put on birth control pills, studies from Northern Europe have shown that you get a 500%, get this, 500% lifetime increased risk of death from breast cancer.
So sad.
That's a 5-fold increased risk of death from breast cancer. Risk of death. Wow. Those are crazy statistics, but that study was done first, I think, in Sweden. I've got it I think it's in this progesterone book and also my breast cancer book. And the second one was, I think, in Norway. I could be wrong. I could flip that, or it could be other countries. Anyway, it's 2 of the Northern European countries that really can keep track of their citizenry. So they knew exactly what was going on, what they'd taken, socialized medicine, everything else. They got it, and that's where the data came out of.
That's
terrifying. Those studies have been suppressed here, actually. So, wonder why. Okay.
Did we skip number 4?
We forgot to do number 4.
Oh, really? Oh, yeah. Yeah, because you have TMJ, don't you?
I do.
Cools off TMJ, number 4. I was seeing if anyone was watching or listening.
Are we going to circle back?
No.
Circle back?
No, we're not circling back to anything. Cools off, we don't ever say that. Don't ever say that.
I have TMJ, and I definitely notice it right before my cycle, and that is when I kind of self-adjust and take maybe an extra half
or progesterone,
of progesterone
RDT,
at night. And
rapid dissolved tritium, right?
Yeah, and it just helps not hurt. Just sometimes it just hurts to talk.
Yeah.
So,
your mom says that women have to get their 5,000 words in every day. Is that true?
Mine's up to 10,000.
Yeah, I can see that.
I'm an overachiever.
Yeah, you're talkative. Okay, cool. Cools off TMJ. So what should happen right before your cycle begins is, say it politely, is you should mount a huge progesterone response. Mm-hmm. And some women, for genetic reasons or for, it's mostly genetic reasons or for nutritional reasons or for stress reasons, who knows why, they cannot mount that response. And they get the PMS, the TMJ, all that. Mm-hmm. Okay. Sorry about that.
Yeah.
I'm glad it helps you, though.
Yeah.
So we did 5. It was dramatically treats endometriosis. Now we're going to do, this is going to be posted, right, Jackson?
This list?
Yes.
Yes, it actually will post at 7:25.
The whole list. It's really cool, all the things I noted. So, and this can all be looked up in my book. Remember, Progesterone book on sale on Kindle? Okay.
Good plug.
Leave a review.
Good plug.
Okay. Number 6, helps fight osteoporosis. Did you know that?
No. How does it do that?
It's super cool. It helps fight osteoporosis because it's like estradiol and testosterone will force minerals into the bones. So that's why women get osteoporosis or osteopenia after they're they go through menopause because their low hormones don't allow them to push minerals into their bones. So that's why I always suggest HRT when it's possible.
I think so many people just forget how much, just a normal osteoporosis has to do with hormones. They
Mostly.
think, oh, I need to just drink more milk. And it's like, no, there's so much more.
I had a number 1 book about osteoporosis.
No way.
Yeah. Was number 1 for a while on Amazon, Kindle. Yeah, it was called, what's it called? Osteoporosis? No. What's it called?
Yeah.
Out of the Bone Age? No, that's out of the Ice Age. Just my thyroid book.
I think it's just, I don't know.
It's
Treating
called
osteoporosis.
osteoporosis.
Oh, right there.
Well, there it is.
I
We're sitting there debating like dorks. Resolving Osteoporosis, the Cure and Guidebook. So again on Amazon.
Nice.
Kindle.
That was a good plug.
Yeah,
Part
wow.
2.
No.
All right, let's
Why don't we
keep
give
going.
this away to someone too?
Okay.
Someone who's got bad osteoporosis that wants a book on it, make sure you say something. First one to say something will get it.
Cool.
If you want. Sorry, I don't want to embarrass anyone, but I'm just like someone who has osteoporosis to get the book. Number 7, mood elevates very nice. Oh, let me go back to number 6. Osteoporosis. That's why I look at those intracellular vitamin panels with osteoporosis, because the bisphosphonates and so many other medical pharmaceutical treatments are given to patients who have massive vitamin deficiencies. That causes brittle bones. I believe that's the root cause of the crystallized bone problem that they see with those. Because I've seen women treated with those that had both a calcium, a vitamin D, a magnesium, a zinc, and other deficiencies that would not allow hard bones. So that's got to be addressed first. And I talk about that in my book. Okay. Number 7, mood elevates very nicely.
Yeah.
Do you agree with that?
Oh, yeah.
Is that why you're kind of normally happy in the morning?
Kind of.
Barely?
Partially.
Yeah, you work night shift, though.
I do.
Do you take your progesterone before you go on?
No.
You take it when you get off, right?
It's actually nice when I do get home around 7 a.m. and the sun is up. It helps put me to sleep. Yeah.
And then do you know why it mood elevates?
No.
It increases serotonin levels. So
There it is.
progesterone is a hormone, but it pushes up
Happy
serotonin
hormone.
levels. So number 8, thickens hair. Look at me. Oh no, don't look
Here
at me.
you go. You can have some
Look
of
at
mine.
cousin Will. Oh my gosh, that kid has thick hair. I remember when you were little, Will, you had like massively thick hair, like you were wearing a giant wig or something all the time.
Yeah, but it was so blonde you could barely even see it.
Yeah, it was blinding.
You must have great progesterone levels.
Yeah, really.
I always knew.
Yeah, fantastic progesterone levels.
Okay, number 9. If levels are kept high enough, greater than 10 nanograms per milliliter, 10 nanograms per milliliter, and I'm going to show you a lab with that. Natural progesterone dramatically. It's a 500% decrease, according to the American College of Epidemiology. 1981, big review of the data going back, 30, 40 years. Decreases the risk of breast cancer. 500% decreased risk. That's huge.
Why wouldn't you not be on top of it then?
You better. I mean, but wait until you hear number 10. And that was, I don't know why no one talks about that study. It's crazy. That was an awesome review back when reviews meant something by the American College of Epidemiology. It was when I was in medical school.
Oh, so
Can you believe that?
like dirt. Dinosaurs would still roam the earth.
Dinosaurs were chasing cavemen and women and getting their progesterone. Eating their progesterone. Oh my gosh, that'd be horrible. Okay.
Okay, number 10.
Number 10,
The
if
most
levels are kept
important.
high enough, greater than 10 nanograms per milliliter again, natural progesterone dramatically, that's a 1,000% decrease. That's how dramatic it is. Decreases the risk of all cancers overall.
See how much it plays into every single system in your body?
Man, it's massive. It's probably the most immune boosting anti-cancer thing you can do.
So how does it do that?
I'm not sure. I don't know. I don't know that they explained it. The data they looked at was huge though.
It's crazy.
So, and those are the American College of Epidemiology, 1981. It's in my breast cancer book, and I think it's in my little progesterone book. So my breast cancer book, which was number 1.
Which we don't have sitting out here.
Oh, that
Sadly.
was Tom, yeah. It was the breast cancer patient survival guide.
Yeah.
So, okay. You want some bonuses?
I want some bonuses.
Gets rid of most female anxiety.
Oh, yeah.
So like this stuff or Progestins Plus, which is another really, really good option. You put a little dab on you while you're having a little panicky anxiety during the day, and it will, maybe a drop or two, and it will
Yeah, just a little drop or
alleviate.
two.
Yeah, you don't need much. You
wanna
don't want
go
to fall
full
asleep with your face planted on your desk.
But yeah,
You
I
ever done
can
that?
attest fall asleep on my desk.
Yeah,
Oh, yeah.
I never have.
Oh, right. Oh, we have a couch for you in here. That's why it's not
have
on
a
your
couch.
desk.
I fall asleep on my couch.
It is something nice to just keep on hand.
In your purse.
Yeah.
Perfect purse size.
Perfect purse or
Someone's
purse size.
Purse. Someone's going to win this tonight. We don't know who. Jackson's scanning the questions right now. Okay, bonus number 2. Unlike synthetic progestins, like in birth control pills, and there's no natural birth control pills, sorry, and that shot is definitely not natural. And anyway, natural progesterone markedly reduces the risk for clotting, does not increase the risk for clotting. Not even if you have factor V Leiden, actually. Though I know most doctors don't prescribe it then because they don't know that. It's the estradiol that causes the clotting.
Estradiol causes the clotting.
Yeah. Okay, bonus number 3. Natural progesterone causes apoptosis of fibrodense breast tissue. You can go on PubMed and look up progesterone and the word apoptosis. I think you'll see 2,000 studies come up. It causes apoptosis of breast cancer is what it does.
And what is apoptosis?
Pops it.
Well,
Progesterone, especially if it's progesterone receptor positive breast cancer, it'll attach to it and pop it.
there you go.
So, but the fibrodense breast tissue that so many women have, when they go, I can't get a mammogram, it doesn't do me any good because I have dense tissue. Yeah, you need to take progesterone, sister, because those cells are mildly to moderately pre-malignant. Your breasts will tend to get lighter, fluffier, and sorry about this, but larger too. The use tenderness you get when you first start taking the progesterone, that you first feel is from the death of these pre-malignant cells. So that tenderness that's so annoying is because your breasts are getting lighter, fluffier, and cleaner from breast cancer.
And did you know, for everybody listening, fluffier is the medically correct term?
It is.
Really?
Did you learn that in something?
Sure.
Bailey's full of it.
No, but it's a good way to explain it.
Yeah, they're
Fluffier.
lighter, fluffier.
Instead of being so hard and dense like
Yeah, you want them fluffy.
sourdough bread,
Right.
it's like Wonder Bread.
Okay.
There you
That's
go.
what some husbands think. Okay. So we'll leave it right there. Okay.
And
Sorry.
some wives. We're all inclusive here.
Okay. Yeah. Sorry. Yeah. Some wives. Sorry.
Good catch.
Okay. So there's 6 ways to take natural progesterone.
Okay.
A cream.
A cream.
What's the problem with the cream?
Not very effective.
It's not very effective because within 90 days after it's manufactured, it has zero efficacy,
Potency.
zero
Oh.
potency. Yeah, there's several studies now have shown that. I think at least 2, maybe 3. So I don't know about
So
several, but
when would you do a cream? For
Nah.
what kind of you just avoid it completely?
I don't even try it
All right. Okay.
because you can't tell me when you buy it off the shelf or when you buy it from a pharmacy how long it's been mixed or anything.
Gotcha.
I mean, you can ask the pharmacy. Maybe they made it that day, or maybe they just put it in the tube that day. But if they made it a week or 2 or 3 earlier, or 4 weeks earlier, you've already lost a month. You've already lost a third of the potency.
Oh yeah.
And by the halfway mark, it's halfway gone. And by the last of the 90 days, it's 0.
Okay.
So that doesn't work. So
I don't like that.
next, so that's why we've gone with serum designs. We're the only ones.
Mm-hmm.
Injectables, which oddly enough, OBGYNs will use when you're pregnant and can't mount enough of a progesterone response. They'll use natural progesterone in an oil, an injectable. But no other time in their practice will they use a natural progesterone.
To help boost levels.
Won't do it.
Wow.
Weird.
That is weird.
It's like, we know to give it here and now because it's safe and good for the baby and the mom, and we'll inject it in your butt. But we won't give it to you any other time.
Yeah.
Like in the capsules, compounded troches, or the best way, the rapid dissolved churcher. Though the cheapest way to get compounded progesterone is through, serums, but through capsules from a compounding pharmacy. And then also, you get better sleep with the capsule because of what it does when it first passes effect through the liver.
Wow.
It causes you to get drowsy.
Wow.
So capsules are the best for sleep. The RDTs are also really good for sleep, and so are the troches. But I think troches take too long to dissolve. They're awkward.
What do they look like?
They're big, waxy things.
Okay.
Okay. So that's all I'll say about that. So, and I will post that lab. You can find all this and more in my, again, #1 bestseller 3 times now, Progesterone book by Dan Purser, MD. Let me hold it up. So there it is. Jackson.
Yep.
So are you going to pick a winner for the book so I can autograph it? And I will also, should I autograph the progest-avail bottle? I will autograph both. So
that would be kind of cool, yeah.
let me what?
That would be kind of cool, yeah.
Okay. They said weird, which is going to be weird too. So, okay. Any questions?
Yes, we have a lot of questions. We had several people ask a similar kind of question. This one is, will women post-hysterectomy without ovaries benefit from natural progesterone?
So that a common misconception put out by MDs and DOs and physicians in general is that you won't benefit. Oh my gosh, you're still a woman. You still need progesterone. Just because your ovaries aren't there, guess what? No one postmenopausal has ovaries. You might have little shriveled raisin-like things in there, but those are not ovaries. I mean, kind of barely, because technically they're little dried up fritter.
Little raisins.
Yeah, raisin ovaries, but they're not ovaries. So it's, just because they're removed does not mean you're not a woman, you don't need progesterone. Because I have dealt with so many women who've had hysterectomies, have horrible hot flashes, only alleviated with progesterone. Really? You're going to tell me they don't need progesterone?
And just like what we talked about earlier, it's not just for reproductive. It has so many different uses
huge
throughout
benefits,
the body.
Yeah.
Yeah.
The average peak age for breast cancer in the U.S. used to be 65. Now it's bimodal. There's one in like 34. That's from, I believe, the birth control pills younger women are being given. And then the old one that was 65 when most women got breast cancer. That was the highlight, the high point, not the highlight. And that's because they'd gone 15 years without progesterone. Okay, next question, Jackson.
Crazy.
Yep. Let's see. Sorry, I'm going through a lot of them.
Oh, no.
How young can a girl start on progesterone?
I know our daughters because we've had 5 of those rascals. Here's one. And when they start doing the pre-cycle thing, like our daughters did, some of them did 11 or 12, and they'd get really miserable. You give them a drop or 2 of like a serum or something then. So you could start early, but just to give it some alleviation. But if it's not too bad, leave it alone. But yeah, they can start pretty early. Won't hurt them.
Cool.
You can't tell me that they can make an adequate progesterone response. You're not going to suppress their production giving them a little.
Well, that's a good question. It won't suppress.
No.
Nice.
No, go off that bad boy and see what happens next week. Yeah, well, I'm moving. We're all moving. So they will be gone. Don't try to follow us.
We've had a lot of people asking specifically about Progestins Plus, how much to take and where is it effective to put on?
Always start with 1 drop. Go up from there. You can go as high as 8 to 12 drops. I've had women tell me they pour a bottle on every night, which is insane. They need help. They need more. They need something stronger. Contact me if that's the case. But you can start with 1 drop. Go up slowly. I always start low. Go slow. Put it on over your carotid artery, on your wrist, or behind your knee. Those are the best places. I know I've heard all kinds of weird stuff. Put it on your breast. Put it on your tummy. Put it on your thighs. I put it somewhere near your arteries. So, because it'll get absorbed.
Perfect.
And we'll leave it right there.
Yeah. Can someone use this if they have factor V Leiden?
Yes.
Cool. This was a good question. How is TMJ related to PMS?
Well, like Bailey said, so progesterone cools off everything in women, especially joints. And TMJ, for some reason, seems women do, back to what my wife says, they must speak 5,000 words every day. They talk all day long on the cell phones, on everywhere they're going. And yeah, like me, I have to talk a lot, but I probably say more than 5,000 words, but just because it's my job. But they work that jaw, so they need the progesterone, and it does cool it off.
Wonderful.
It's crazy. I've probably heard that from 400 or 500 women over the years.
Yeah.
A lot.
Does using natural progesterone help with menopause belly fat?
So there's been a number of studies showing that progesterone levels do not increase weight or fat. They actually normalize weight when you have a normal natural progesterone level. The synthetic progestational agents, like in birth control pills and all that, they tend to increase weight. They androgize. So they're very androgenic and can cause a lot of problems. So they tend to grossly increase weight.
Okay. What is your opinion on natural hormone pellets?
If nothing else works, and I really get extensive on that because I'm almost the same way with progesterone. I'll look at vitamin deficiencies. I'll look at genetic errors, things like that we need to work around. If I can't get the woman to make her own natural progesterone, I'll give her progesterone. Postmenopausally, they're not going to make progesterone, so I'll just give it to them. But what was the question?
Does it help reduce menopause belly fat?
I already answered that, didn't I?
No,
Sorry,
doing the pellet
the
one?
hormone pellets. I'm sorry.
Yeah. So if it's the last resort, nothing else works, I'll do pellets.
Yeah.
But it's rare.
Yeah.
That's an easy, quick fix. It's almost a Band-Aid. You need to really look at other issues, other potential causes first before you go to the hammer. And that is the hammer.
Yeah. Someone asked if it's possible to correct osteoporosis after menopause.
Yeah.
Like you explained. Yeah.
Yeah, see it all the time.
We're having a lot of people asking if they should take it if they're between the ages of 60 and 70.
Why not? They need it. They're hot flashing, they're night sweating, or they want to prevent breast cancer, or they can't sleep at night. All those, hey, it's better than Ambien. Sorry, did I say that out loud? or benzodiazepines. Oh, let me say that. It's better than strike that first comment. It's better than benzodiazepines, which are addicting and horrifying. So, and it works naturally. Won't give you nightmares.
I guess a good question would be, is there anyone that should avoid using progesterone?
Men. It's very pro-inflammatory in men. Reduces sperm count and other things. You don't have to worry about them getting a little on them. That's not a big deal, but they're using a lot of it to sleep or whatever. I would not do that. And I know there are not a lot, but some naturopaths and chiropractors who advise that. I would not advise that.
Do you suggest putting the progest-avail in capsules and ingesting orally?
I would never do that. I would never say that.
Okay.
What about women that currently have breast cancer?
They should listen to their doctors. Okay, yeah.
What about
I'll tell you what we did. The advice I got before we were doing research, and these are by some of the best pharmacologists in the U.S. Even if it's progesterone receptor positive, because I was telling women to stop their progesterone if they were taking it, they said no, you should go a lot higher. You should tell them to take more because it causes apoptosis of breast cancer cells. Again, if in doubt, go to PubMed and look up those two words, progesterone and apoptosis. You'll see I'm thinking it's 2,000 studies, if I remember right. Really? You're going to argue with that? And they will argue with that. They'll go, no, you shouldn't do it. So listen to your doctor first. But if you really are, which a lot of my patients don't listen to doctor, they do their own thing and they're not going to listen. You can decide. You're big kids. But I would never go against your doctor.
Very good. A lot of these questions are kind of repeating. Definitely go back and listen to this recording once it's posted. Check out the other post of the list, and check out the books. Definitely. And I think Dr. Purser and Brecken will both jump on and try to answer more of these questions too. Do you guys see anything that really stood out to you?
A lot of people just expressed some serious interest in your osteoporosis book. So for the people that are just logging on, do you want to let them know where they can get that?
You can get a paperback or Kindle on Amazon. It's been #1 before, and I think it was #1 for a month or two when it came out. That's pretty cool. I've had how many? 12, 15? I can't remember how many #1 books I've had. I lost count years ago. So it's called Resolving Osteoporosis. It goes through a process that you can get your doctor to do. Probably not, but you could try, and it works. And we flip cases. I won't say often because I don't get that many to flip, but whenever I get them, they flip.
what about taking progesterone while having an IUD or on birth control?
Good question. Yeah, do it.
Do it.
Though it may. I don't think it'll affect your birth control.
Okay. It'll just affect your progesterone levels.
Yeah.
Cool.
Because when you're on birth control pills, they will shut down your ovaries.
Yeah.
And that's the idea. And that I know they say they're going to do it to help you cycle. You are not cycling. You are hemorrhaging once a month.
Yeah.
It's nothing natural about it. So you're not ovulating, you're not hemorrhaging. I mean, you're not having a period. You're just you're just hemorrhaging. So that's all it is.
It's terrifying.
Yeah, and that's why the newer pills are like, let's go 6 months with no hemorrhaging. That's what it is.
For the people that are asking, how much should I take? What do you think?
Varies.
What do you think would be a good indicator that they're taking too much?
If you're sleeping in until the Price is Right comes on, that's usually around 11 or 10 in most parts of the country, and that's too. And you should be up and at work by then, probably. I don't know, or have your kids to school or something. So if you're sleeping in, if you're going 12, 13 hours, you're taking too much. So, and that's how I tell women to gauge it. So most of these help. That's why I put it #1. It really, really helps sleep.
Mm-hmm.
Yeah.
Immensely. So, okay, let me give you one big last super bonus tip. If you want to try progesterone, try some of the serums. You can contact my office for advice on those or how to get those. But if you want to get the prescriptions, it's easier than you think. Go to a compounding pharmacy in your community. Go to 2 or 3, especially one that makes an RDT, because that's kind of the highest art of progesterone. If they make a rapid dissolved triturate or even a troche, ask the pharmacist at that compounding pharmacy how. Don't ask how. Say who's a good doctor who likes to prescribe your triturates or your troches, and they'll be flattered and they'll go, I'll give you the list of 2 or 3. Say you're looking for a doctor, will prescribe them for you, and you'll have the doctor there locally. If you can't find someone, you can always get an appointment out here, fly out and see me, and I'll get you on it. Once a year, you gotta come out. We'll just Zoom calls otherwise and stuff. So that's my big tip there. You go to your community compounding pharmacy and they'll set you up. They'll hook you up. So,
Yeah, I did see that question too. If people can come be your patient.
yeah.
Yeah, I think sometimes
Yeah,
we forget
but
to mention that.
I'm just gave you a much cheaper, easier way to do that.
Yeah.
So I'm
But
not really,
there's many reasons why someone would want to become your patient with the vitamin
I'm super
and
cool.
and genetic panels. Anyone can do that from afar,
Oh,
anywhere.
yeah,
Just
that-
working on the supplement side. No prescriptions. We can do telemed from all over the country, sometimes even over the world.
If you made plenty of progesterone before, had a baby or whatever, and then can't make it now, probably it's a vitamin deficiency. Good nutrition in equals good hormones out. Got it? I mean, I'm going to say that probably every Facebook Live, but good nutrition in equals good hormones out. And good hormones out means lots of progesterone, like you can see in that lab example we posted. So, has that gone up?
Should
Yeah,
have.
11 minutes ago.
Yep.
Yeah. So look at the bottom of that list. There's a copy of a lab. It's 10. It's above 10 nanograms per milliliter. That's as good as it gets. I've seen them at 20, 25. So when a woman's, that could be the level for a woman on her the day before she gets pregnant, the day she has her baby 9 months later, it could be 950. It was that high.
Holy moly.
Progesterone, yep. But I have someone with severe progesterone resistance that take 15 RDTs every night.
15.
I have about 11 of them now, which fits because they have the 1 out of 200 have that problem, and I have about 2,400 patients I prescribe to.
Progesterone resistance.
Yeah, it's from lack of progesterone receptors. They're born with it. They're missing half their receptors. Usually, it's the alpha receptors. So if I remember right, it could be the beta. I can't remember now.
Wow.
Look it up.
Here's a good question. Can you take, I think they're talking about natural progesterone. Can you take this long term or is it just a short term solution?
No, it's long term. The long term real solution though is usually trying to figure out why you have no or low or poor progesterone production. But if you're postmenopausal, what are you going to do? Nothing I can do to make that happen again. Your ovaries have shriveled up their little raisins. They moved out. They moved to Antarctica or somewhere like that, right?
Right.
It's a long way from that.
I've been getting this question a lot. I don't know how you want to respond to it about Progestins Plus versus Progestins Phyto Plus. The difference between the two and the concentrations. They're different formulas. So
Yeah, you need to ask your upline.
Okay,
You need to ask the Young Living. I better not tread in that water.
perfect.
Though we make them both.
Yeah.
So I'm just
Um,
going to leave that alone.
did any of those questions stand out to you? I'm not great at picking the winners for things. Brecken's usually really
Shut
good.
your eyes, close them, poke the laptop, and pick one.
Okay, we can do that. Just a random question on here.
Yeah.
Let's see.
Who is it?
Well, this isn't a question. It was Rachel Moormeyer. This is a great tip, she said. So you're the winner.
Rachel Moormeyer. You won. What did she win? The book?
What do you want her to win? She can
The
win.
autographed book?
Perfect. Yeah.
Okay, good.
Okay.
Rachel Moormeyer. You'll get her spelling and everything. I'll sign that tomorrow.
Yeah.
Now for the progest-avail, because I don't have any Progestins Plus. If some super duper mega crown diamond wants to send me a few bottles, I'd much appreciate it. But I am going over to Young Living a lot more recently for a number of reasons you guys kind of know. But I need to grab some when I'm over there sometime. Haven't. So, and no, I don't just grab it from the bunch we make every other month. I wish I could, but no, can't do that.
Okay, we're trying to do
Yeah,
a winner of the
Progest-avail
progesterone.
giveaway. Come on, Jackson.
I'm sorry, it's not.
We're
loading
looking for
all
your
the questions.
They're
girlfriends
all
on there.
saying congrats and they're jealous, so all the comments are flying in right now.
I got one.
Yeah, you found one.
Yeah, Christy Banks.
Okay, how do you spell that?
CHRISTIBANKS. She asks, is there any easy way to decipher if your levels are high, low in progesterone? Yeah, get random levels. If your doctor won't do them, they're just progesterone serum levels. Go to my website, danpursermd.com. Use the Direct Labs link and order a progesterone level. They're cheap. and go get one. A few weeks later, get another one. A few weeks later, get another one. Yeah, and document it, and if you need to, if you're my patient, text them to me. I'll peek at them for you. You'll know if you're making enough. You'll see it pop up when you're going through your cycle, or if it drops, you're in trouble, and you know you're in trouble already. So, Christy Banks, you won some progest-avail. If you don't need it, give it to a friend. So, awesome. Thank you. I love you all.
Real quick,
what?
I just want to remind everyone with our physician design giveaway that we've been doing this month.
Really?
If you remember the little Facebook Live we did on Friday afternoon?
I barely make it through the day. Are you kidding me?
Yeah. Well,
I get overwhelmed, man.
The whole deal, what we're doing is every Friday we're picking one of our subscribers on physician design, those that have our products on subscription, and we refund one order every week. Every Friday we pick that winner and announce it.
I approved that somewhere and did the ad, didn't I?
Yep, you did. You were there.
Man.
So
sorry. That's what happens when you're running a biotech and a supplement company and a medical
we're busy
office,
these days. We definitely are. So again, next Friday we're going to be doing another winner. So if you already have your subscription in this month, you're good to go. Otherwise, there's still a chance you can jump on a subscription and be our next winner.
And good things happening with the biotech. That's all I can say, or they'll beat me up. Love you guys.
We are getting very close.
Very, very close. So, love all of you. And God bless, and go in good health.